The property which enables myocardium to conduct electrical impulse is called conductivity. Human heart has specialized conductive system through which the impulses from SA node are transmitted to all parts of the body. The conductive system of human heart comprises of SA node, internodal pathways, AV node, bundle of His, and Purkinje's fibers or system. So this diagram showing all those different structures: sinoatrial node, internodal pathways, atrioventricular node, the bundle of His, and the right bundle branch and the left bundle branch, and then you have a Purkinje system which are going to innervate the entire ventricular system. This is another diagram showing the SA node and the internodal pathways such as the posterior internodal pathway of Thorel, middle internodal pathway of Wenckebach, and the anterior internodal pathway of Bachmann. Then we have AV node, then the atrioventricular tissue, then it gives rise to bundle of His, then the left and the right branch of bundle of His, which is eventually going to lead to Purkinje system. Sinoatrial node is a small flattened ellipsoid strip of specialized cardiac muscle. It is about 3 mm wide, 15 mm long, and 1 mm thick. It is located at the junction of superior vena cava with the right atrium. The SA nodal fibers connect directly with the atrial muscle fibers, so that action potential from SA node immediately spreads to atrial wall. The SA node contains small round cells called P cells or pacemaker cells. The action potential is largely due to the calcium with no contribution from sodium influx. Prepotential is prominent in SA node. Even though all parts of the conducting system can generate impulses, the rate of rhythmical discharge is faster than that of any other part of heart. That is, it is around 70 to 80 per minute. The generated impulse spreads downward and activates the other parts of the heart. So depolarization of other parts of the conducting system occur before they discharge spontaneously, and hence SA node is the pacemaker of normal heart. Internodal atrial pathways. The ends of sinus nodal fibers connect directly with surrounding atrial fibers, but conduction is more rapid in some bands of atrial fibers. These bands of fibers are called internodal atrial pathways. There are 3 bundles of atrial fibers, that is anterior tract of Bachmann, the middle internodal tract of Wenckebach, and posterior nodal tract of Thorel. The rapidity of conduction is because they contain a specialized fast conducting fibers of Purkinje type. AV node, atrioventricular node, is located in the posterior portion of the interatrial septum. It is the only conduction pathway between atria and ventricles. This is because atrial muscle fibers are separated from the ventricular muscles by a fibrous tissue ring, which is called as annuli fibrosi. Atrioventricular node it also contains P cells, but fewer in number than SA node. So rate of impulse of production is also less, that is around 40 to 60 per minute. Sometimes AV node can generate impulse when SA node is out of order or if the conduction of SA node is blocked. Other parts of the heart can generate this rhythm and they are called ectopic foci. Atrioventricular nodal delay. On reaching AV node, the spread of impulse is slowed down and then it is transferred to the bundle of His. Thus, the transmission of impulse suffers a delay of about 0.1 second and is called as AV nodal delay. This is important because atria gets enough time to empty blood into the ventricles and efficiency of ventricular pumping is increased, and it prevents entry of two rapid impulses from atria into ventricles. The causes for atrioventricular delay is number of gap junctions are less in between successive cells, and so the velocity of conduction is decreased. There is a presence of multiple branching system is there in the AV node, and the cells of AV node are made up of small diameter fibers in which velocity of conduction is less. Bundle of His, that is also called as AV bundle. Atrioventricular node is continuous with bundle of His. Bundle of His originates from ventricular surface of AV node and runs along the right border of interventricular septum. It runs for a short distance and soon gives off left bundle branch at the top of interventricular septum and continues as right bundle branch. Left bundle branch divides into anterior fascicle and a posterior fascicle. All the branches run subendocardially on either side of septum. A special feature of AV bundle is one-way conduction of impulse, except in abnormal cases. Purkinje system. It is an extensive network formed of the Purkinje cells present subendocardially, which transfer impulses to working myocardial cells. They are fast conducting, very large fibers with extensive gap junction. So the cardiac impulse is instantaneously transmitted to entire ventricular musculature. The ends of the Purkinje fibers penetrate into the muscle mass and finally become continuous with cardiac muscle fibers. This table shows the conduction rate, conduction velocity at different nodal tissue. SA node is 0.05 meters per second. Atrial pathways it is 1. AV node it is 0.05 where it is there is a delay which is called as AV nodal delay. In bundle of His again it is 1 meter per second. In Purkinje system it is rapid, that is 4 meters per second. In ventricular mass it is again